Is it time our NHS did more to protect us, or do we need to continue to protect it?
Good morning. Yes, so I think the NHS should do more to protect us. And, you know, the last 18 months have been a very difficult time for the NHS, and it has protected the public from this pandemic, and it has coped and it has done very, very well. But at the same time, there are a whole load of medical conditions, cancer, mental health, strokes, hypertension, cardiovascular disease that have possibly put on the back burner during this time. So in my practice, right from the beginning, we kept our doors open. There were no locks, no intercoms. We encouraged people to come and see us with other non-COVID related issues, because even 18 months ago, I could foresee that the problems are going to result in a huge backlog for us. That is going to be an immense problem when COVID gets lower.
That's rules, Dr. Irfan. That's your 60 seconds. We'll come back to all of that. Don't worry, we'll come back to all of that. Helen O'Connor, now your turn. GMB NHS union organiser in the southern region. Should the NHS be doing more to protect us? Should we continue to do more to protect it? What's up?
Well, as like Dr. Malik said, the NHS has protected us during this pandemic, and these workers in the front lines of the NHS have saved thousands of lives. And let's look at the bigger picture here. Let's look at what's been happening to the NHS for the last decades. It's been cut and privatised out of existence. The cuts have been going on even during the pandemic, and that compromises patient care. We entered into the pandemic with 100,000 staff vacancies. 40,000 of those vacancies were nurse vacancies, and yet those staff still delivered for us during the pandemic. So what we're seeing is a lack of investment in the wages, terms and conditions of staff on the front line of the NHS. Staff are getting demoralised. They've saved lives during the pandemic. Like I've said, this Tory government is now turning around and delaying their pay rise. And the intention behind that is to demoralise staff further and make them leave. And how is it possible that staff can cover everything when there's huge vacancies, massive recruitment crisis, beds are being cut, hospitals are being moved.
All right. Okay, well, look, Dr. Irfan, respond to that. Then quite strong stuff there from Helen, but I mean, basically saying that we're systematically grinding our NHS into the ground, and I suppose the way that we can continue to protect it is actually to throw more money at it.
Absolutely. I can't disagree with Helen there. I know this is a debate and we're coming from slightly different angles, but I agree. Underfunding, lack of resources, the staff.
Is that money always very well spent? Sorry, just to interrupt quickly. Is that money always very well spent though? Because I know people who sit on NHS trust boards. They have to turn up to a few meetings a year. They're on a six-figure salary. All of this stuff. Are we always spending it that well? Pharmaceutical companies ripping us off.
The money could always be used more efficiently. There are layers and layers of management that maybe doesn't have to be there. And for example, in primary care, if you just let us as small practices, independent contractors, get on with our work and sort the problems out, we can do that for less funding and use that more efficiently. But we're under a government. The Department of Health, NHS England, gives us all this guidance and rules that we have to follow. So I agree with you. The funding could be used more efficiently.
Just to throw back over to you, Helen, I understand what were the points that you've made there, of course. Now, I had a quick look at some places where I'm near my neck of the woods originally, the Greater Manchester area, and the occupancy there and the busyness, I suppose, of critical care wards there pre-pandemic. And actually, they were operating at around 96%, and then that kind of remained a bit the same during the coronavirus crisis as well, went up slightly. But my point is that now we're not really at those levels. And so, right, okay, you say the NHS might need more funding, it might need more staffing, it might need all of these things. But if we're kind of almost back to where we started before the pandemic, why have we now got 13 million people, on hospital waiting lists? Why can't they step it up again, Why can't we? Surely they should be able to be doing better than they are now, regardless of the fact that maybe they still need more money,
Well, it all comes back to how the money is spent, like Dr. Malik quite rightly said. And what we're seeing is a lot of money going to private sector and into private companies that are actually moving into the NHS now. And when you have a private company operating in the NHS, you've got to bear in mind that money goes to shareholders, so dividends, etc. And it always costs more and it's less efficient. We've seen that with the test, track and trace system and the 37 billion that's been given to companies that have essentially failed us. They haven't provided the PPE, they haven't provided the test, track and trace. So it is a question of how the money is spent, but also there's been a deliberate defunding and hollowing out of the NHS. And that's Tory party ideology. What they want to do is they want to funnel the NHS and move it all over to the private sector. Sajid Javid...
Do you not get better care in the private sector, though? Is that not why people go
No,
private?
you don't. No, you don't. It all looks shiny and new and everything. But, I'm an ex-NHS nurse and I know the way it works. And you don't necessarily get better care in the private sector. In fact, they rely heavily on agency staff, and it's you don't get better care. That's a myth, actually. And when we look at the cleaning companies in the NHS that are operating, they're not delivering good services in the NHS. And they were cutting cleaning during the course of this pandemic. So there's no thought there to safety or patient care. So we do need to look at where the money is spent. And a lot of it's going to the top. And like I said, the wages, terms and conditions of the frontline staff in the NHS are not being addressed. And it's deliberate. The intention is to demoralise staff and to make them leave. Then a service fails. Then it gets privatised. And then you get a more expensive, worse service. Yeah. That's what's happening at the moment, Patrick.
All right, I'll return to that, Helen, but obviously we've got to bring Dr. Irfan back into it now. Look, Dr. Irfan, some people who have been tweeting or texting may say this. Some people may say that actually people who work in the NHS a lot of the time, do a lot of good work, but they have got their hand out. They are heavily unionised, and therefore it's not uncommon, is it, to have things like pay rise and highlighting shortages. Maybe they should just be getting on with the job.
Well, they have been getting on with the job, and that's been shown in the last 16 to 18 months, that they have soaked up so much during this pandemic and come on top, even with the deficiencies of funding and the deficiencies of staff. Even under very, very difficult circumstances, they've coped. But now the workforce is very tired and burnt out, and yet we have to pick ourselves up again and get through this backlog now. And I don't know whether our staff has that capacity to do this, because this is going to take 4 to 5 years to correct itself.
Okay. Helen, just to say, is it not a bit of a leap to suggest that it could essentially be Conservative Party policy that in some way it might be a vote winner to destroy the NHS? I mean, it's not, is it? It's not going to. No one's going to vote for a party who's essentially deliberately destroyed your National Health Service.
Well, it's Tory party ideology, and they're not doing it in an open way. It's happening by stealth, Patrick. That's the point. And I just wanted to come on to your point about unionisation, because NHS staff aren't heavily unionised. In fact, many aren't in unions at all. So I would certainly put a call out to all the stressed out, demoralised staff to join a trade union, like GMB trade union, because what we will do is we will organise on the shop floor. And if you're properly organised within a trade union, you can push back against some of these restructures and cuts that are happening.
Is it quite lucrative being quite high up in a union? That's kind of not something that we're here to discuss, is it? At the end of I wouldn't mind it if that's all right. Is it? No, just
about how the NHS staff are suffering and struggling and stressed and demoralised. And what unions do is unions enable NHS staff to come together and to push back against some of these restructures that are imposed top down that always lead to cuts at the end of the day, while the top does mushroom and there's lots more management positions open up. That's what's going on in the NHS at the moment, and that's why we need to get organised and to resist it, and the unions need to join up with the NHS community campaigners, and we do need to resist what's going on, because at the end of the day our right to free healthcare is slowly being removed by stealth.
Do you know, do you, just out of interest, do you have any idea what the people at the top of that union earn?
I have no idea, and like I said, I'm not here to discuss it. I'm an ex-NHS nurse myself. I spent 28 years on the front line protecting patients and looking after patients. And I feel really, really strongly about unionisation in the NHS. And that's why I've come over to do it full time for the trade union now.
And you earn more money for doing that, do you?
It's the equivalent of what I used to earn before,
okay.
But that's not the point.
No, I think it's a worthwhile question. I'm not trying to hinge the interview on how lucrative. I think it's just something to know.
It seems like you are, but I just want to get back to the point that I speak to NHS staff every day. I speak to the cleaners, the nurses, the porters, all of the staff, and they're just telling me that they were unsafe and unprotected during the pandemic. They're angry that their pay rise has been delayed. They're calling for a restorative 15% pay rise to make up for everything they've lost. Okay. The GMB union is backing that call 100%, by the way, because we don't want staff to the NHS and exacerbate the recruitment crisis.
All right, Helen, great points. Thank you very much, Helen O'Connor. I'm just going to final word to you, Dr. Irfan, if that's okay. Look, I think a lot of people, are you worried? Is there a concern, Dr. Irfan, potentially of of the public, maybe some of the public who've traditionally got a huge amount of love for our NHS and people who work in it, turning against it a little bit when they realise that, Dorothy can't get her hernia sorted and, so-and-so can't get his dodgy knee replaced. And actually all of a sudden people might start going, oh, you know what, I start to hate the NHS now. Is there a concern about that for you?
Absolutely. 13 million people are on a waiting list for some kind of intervention at hospital. So there are going to be a lot of frustrated people out there. But like I said before, in the pandemic, we've saved the government's bacon. We've pulled through. And, the vaccination program has been delivered by NHS staff right from top to bottom. So, we just carry on and we will cope.